Hey, I'm Dave Pavo from Performance Physical Therapy.
And I'm Judah Boulay from Northern Rhode Island Strength and Conditioning, home of No Risk CrossFit.
We're going to bring you a few tips today. I want to talk a little bit about some common injuries that people deal with and how we address them in the clinic.
And I'm going to take those same things that David deals with in the clinic and look at them from a strength and conditioning perspective, helping you strengthen those muscles so that you don't end up back in the clinic.
80% of people are going to experience back pain at some point in their lives. If you're dealing with back pain, you're not sure how to address it, but it's starting to limit the way you move, you might want to reach out to a physical therapist. Here's some of the things we'll look for. We're going to quickly screen your movement. We want to see good quality movement moving forward versus when somebody's in pain and they're starting to compensate and they're struggling to get back up from that motion. Same thing if we look at extension. You go back, nice smooth motion, versus somebody who's feeling pain and they're going to be really restricted. And lastly, we'll see how you're moving. When somebody's sitting down and they're in pain, the right muscles aren't doing their job, we might be moving a little bit differently. We're going to use our hands-on techniques, some manual therapy to decrease pain, to improve your motion, and maybe a few simple corrective exercises to get you moving again so you can start to think about returning to the gym.
All right, so after you have just dealt with going to the clinic for back pain, you can use a strength and conditioning coach to help get you back in the game quicker. One of the reasons why a lot of people have back pain is that there's imbalances between the front side of the body and the back side of the body, and a lot of times this happens because most people spend the day sitting. So one way that we can strengthen our back sides to help alleviate back pain as well as to help strengthen the muscles is using something called a dumbbell Romanian deadlift. So David's going to have the dumbbells by his side. He's going to keep his belly tight. He's going to stick his butt back a little bit. He's going to hinge at the hip. He's going to come down to the end point of his flexibility, making sure that his chest is upright, his shoulder blades are squeezed back together, and he's keeping his back nice and neutral and nice and straight. So at the bottom, he's going to squeeze his hamstrings. At the very top, he's going to squeeze his butt, and he's going to get a couple of sets, three to four sets of 12 to 15 reps, using a light to moderate weight to start. One of the ways to strengthen the muscles that are involved when you throw out your back is using a very cheap and effective training tool called a mini band. So with the mini band, you're going to place it around your ankles. You're going to find a nice wide stance, and you're going to take steps forward, maintaining toes pointed forward and maintaining tension on the band. Take steps backwards and then face one direction and take lateral steps. And these should be steps and not shuffling of the feet. And you're maintaining tension on the band throughout the entire movement pattern. If you get 3 sets of 10 forward, 3 sets of 10 backwards, 3 sets of 10 each side to side, you're going to really find your butt lighting up in terms of working. And this is one way to help strengthen your back so that you don't potentially throw it out again.
So you just threw out your back, you're in a lot of pain, you're not sure where to start. Most back pain will get better in just a few days. The key is to keep moving. Here are a few simple ways to do it. Judah's going to demonstrate. This is called the cat and camel. You're gently raising up your back as far as you can, just within the limits of comfort, lower down, and repeat. Okay, a little extension from there. You can lay flat on your bed, start to press up. Again, within the limits of comfort. It's early, it's going to be a little bit sore. Hold that for 5 seconds or so, lower, and repeat a few times. Good. And best of all, walk. Keep moving, go for a walk. Ankle sprains are one of the most common injuries in sports, especially basketball, tennis, soccer. When we see patients in the clinic with an ankle sprain, our focus is getting back early mobility. We're going to do some hands-on joint mobilizations to try to get that ankle mobility back. And as soon as we can, we start working on some basic balance exercises like single leg stand, so that very quickly you can get back into some higher level balance activities.
Some higher level balance activities with one foot. We'd have you start with a single leg jump, and we can progressively load that jump as you heal and get strength in the leg to higher and higher boxes, till ultimately you're jumping on one leg as high as you can.
There are some simple biomechanical issues in the lower body that can lead to a lot of discomfort. Some people experience hip pain, some will experience knee pain. Here's an easy assessment to look at some of the things we look at as physical therapists. It's a simple step-down test. As we lower down, we're looking to see if there's tilt from the body. We're looking to see if the hips remain horizontal or if one hip's weak and the other hip is dropping down. We're even looking for how the knee falls in. Any of those things that we see might be contributing to some pain in runners or other high-level athletes. Once we address those things, they can start to ramp up their training a little bit.
Two of the things are two great exercises which can help fix problems with biomechanics are using a simple piece of equipment, just a single kettlebell or single dumbbell. So what I'm going to do here is, the first thing I'm going to do is talk about the goblet squat. Goblet squat, we just hold a weight, and this could be any type of weight. Toes are going to be pointed forward, and we're going to stick our butt back. We're going to drive our knees out so that they track properly over the ankles. We're going to come down as low as we can go, keeping the chest as upright as possible, and then stand. From the side, toes forward, driving the knees out, chest as upright as possible, bring our hips to parallel or below, driving through, all the way to the top. The other one, which is a different movement than the squat, is a hip hinge movement, a kettlebell deadlift. So with the kettlebell deadlift, we want to make sure we keep a nice upright chest. We're going to drive our hips backwards, keeping the shins as vertical as possible. We're going to come down, grab that kettlebell, keeping our chest as upright as possible, coming all the way, squeezing the butt at the very top of the movement. On the way back down, we're driving those hips back, maintaining that vertical shin till the kettlebell touches the ground.
Shoulder pain is extremely common and one of the most common things we treat. One of the first areas we'll look isn't even the shoulder. We want to make sure that there's good thoracic mobility so that the shoulder can move freely. Here are a couple simple exercises you can do at home. First, laying over a foam roll and extending back, really working on that thoracic mobility, and then moving up a little bit and repeating. All right? Now we have a second example. You can be on all fours. One hand behind the head. You can extend back and get some really good rotation through the thoracic spine. It's safe, it feels good, it's comfortable. Rotate down and through, get some good flexion, and then repeat that for a few repetitions. Once that thoracic spine is moving well, it allows the shoulder to move a little more freely, and you can progress to some more advanced exercises.
Some of my favorite shoulder strengthening exercises are very simple in nature. The first one is just doing isometric holds. So finding the top of the push-up, make sure the shoulder is stacked on top of the wrist, keeping the belly tight, and holding for a variety of time points. You can make this more advanced by bringing in a bench or a box or a chair and putting more weight on the shoulders, and you can progressively load the height, which is going to progressively load the shoulders. Another exercise is done with a kettlebell. You're going to lie on your back. Kettlebell is going to be straight in the air. You're going to roll fully onto your side and look up at the kettlebell through the corner of your eye and just let that sit there. It's going to push your arm back into the shoulder socket where it should be, and it's going to be wobbly at first, but once the muscles start activating, it's going to stabilize. To make this exercise a little bit harder and to activate all the muscles of the shoulder, you can take a kettlebell, push it bottoms up, and get the same type of activation, except that your grip is now activating more muscles within the arm and the shoulder. And then if you wanted to take it up even another level, you could start to do rotations with that kettlebell. Lastly, if you have shoulder pain and you want to train those muscles in the gym, highly suggest using dumbbells instead of a barbell, because using dumbbells allows your pressing to be in a more neutral grip versus the fixed grip of the barbell, which could add to the discomfort of the shoulder pain. So dumbbells with shoulder pain are one of my favorite strengthening exercises to help minimize recurring pain.
You know, a lot of people think physical therapy is just for the acute stage of injuries when you're in a lot of pain, but we want to do whatever it takes to get you back onto the field or into the gym.
And a lot of people think that strength conditioning is only for higher level athletes when we work with people of all different ages and abilities.
Performance Physical Therapy has 14 locations. In Northern Rhode Island, we have locations in Smithfield, Attleboro, North Providence, and Woonsocket.
Northern Rhode Island Strength and Conditioning, home of Notice CrossFit, is located on George Washington Highway in Smithfield. We have a full-fledged CrossFit program which is for anybody. We also offer one-on-one training as well as small group training where we can individualize our sessions for your specific needs.
Thank you.
Thank you.